Hi there. My name is Maria, and I'm going to tell you about measles, vaccinations, and exemptions. Measles is a highly contagious respiratory illness that is especially dangerous for young children. It causes high fever, rash, pneumonia, and can lead to death sometimes. The measles, mumps, and rubella vaccination is given to children in 2 doses. The first one being between 12 and 15 months of age, and the second between 4 and 6 years of age. The MMR vaccination is proven safe and effective against measles, mumps, and rubella. Some people are allergic to the components of the MMR vaccination, and they should, of course, be granted medical exemption. These people can be safe if most people around them are vaccinated with the MMR due to herd immunity, is what that's called. So you might be asking, if my kids are vaccinated and I am, why should I care if other people get their kids vaccinated if we're not going to get measles? Well, people are still susceptible to measles, in particular, people with suppressed immune systems and children under 1 year old. Measles was eradicated in the year 2000, but with more parents choosing not to vaccinate, we had record outbreaks in 2014. The Amish community and people traveling from other countries are also responsible for these outbreaks. My call to action today is to make it more difficult for parents to not vaccinate their children. Before children enter school or child care in the state of North Carolina, they are required to bring immunization records. North Carolina grants religious and personal belief exemptions. All a parent has to do is bring in a letter to their child's school or child care facility stating that their religious beliefs justify them to not immunize their child. Currently, 19 states have introduced legislation to tighten or eliminate these exemptions. North Carolina is one of those. Arkansas requires parents considering not vaccinating their children provide a notarized statement, receive counseling on the benefits of vaccines, and receive health department approval. I would like to see the same requirements here in North Carolina. There was a bill proposed in March of this year, 2015. It's numbered 346 by Senator Jeff Tart and 2 other senators to repeal the law that exempts children from vaccinations if their parents or guardians object for religious beliefs. We as citizens can support this bill by calling congressional representatives, gathering grassroots support to lobby the government, and using media such as I am to influence the process. On a personal note, I have 2 children, ages 9 and 1 year old, and before my son was old enough to receive the MMR vaccination, he attended several events with me at his big sister's school. So imagine if one of those kids had the illness and didn't know it yet. They could have certainly got him sick. Her school, my daughter's school, has about 900 students at it, so not very unrealistic. So I am also a pre-health student at Fayetteville Technical Community College, and I'm on my way to becoming a registered nurse. So I'm curious if any of you are nurses or in the healthcare field have faced this issue before and what you've done about it. Based on the research I'm doing for my English class currently, there are lots of incentive programs out there to encourage parents and inform them, because most of the time it's not. Most religions aren't against vaccines. Parents are using that as an opt-out. So I truly believe to keep these outbreaks and keep these diseases eradicated, such as measles, we really need to push this bill forward to be passed and keep our kids safe from getting this illness that can really hurt them. So thank you for listening.